to my channel. Today we're going to be talking about the drug-drug interactions in relation to Omeprazole and all the proton pump inhibitors, but we're going to consider Omeprazole as our prototype drug. Proton pump inhibitors inhibit the release of protons from the parietal cells in the gastric mucosa so that within the stomach there's going to be an increase in pH. Now this phenomenon causes a decreased absorption of a lot of drugs and compounds, namely indinavir and atazanavir, mycophenolate mofetil, and then there is itraconazole, posaconazole, and then we also have calcium, magnesium, iron, and vitamin B12. To remember this for calcium, magnesium, iron, and B12, you just have to remember that we need a low pH to release ions like calcium and magnesium from the food that we eat it. From calcium and magnesium rich food, like you need the acidity to release the ions from the food. And for iron, you may know that when heme releases iron, it's actually in Fe+3 form, and to convert it into Fe+2 form, which is the form in which the DMT ion, the divalent metin transporter ion channel on the duodenal cells, this is the form in which it absorbs the iron ion. And then for vitamin B12, it comes bound with animal protein when it is ingested, and you need gastric acidity so that it can break it away from the animal protein so that it can then bind the R binder. And then the R binder is cleaved away from B12 by the proteases released by the pancreas, and it later joins the intrinsic factor, which was also released from the gastric mucosa. But this step, like the release of B12 from the animal protein, requires a low pH, and Omeprazole interferes with that. Coming back to the CYPs, which I mentioned earlier, there are two main isotypes of cytochrome P450 that are inhibited by Omeprazole, and those are CYP3A4 and 2C19. These are not very high yield from the point of view of steps, but it might be important for you to just remember because we might need it later on, but definitely not high yield for the steps. I just felt like mentioning it because these are the most commonly listed ones. So when they inhibit these cytochrome enzymes, the drugs that are metabolized by these will increase in levels. So it can lead to toxicity with certain drugs, namely oral contraceptive pills, because these drugs are all substrates of cytochrome enzymes, and when the cytochrome enzymes are inhibited, these will obviously go up and cause toxicity. So oral contraceptive pills, warfarin, anticonvulsant drugs like phenytoin and carbamazepine, diazepam, and tacrolimus. There are many of them. I've just listed a few. I'm going to post the link of the research article from which I gathered all of this information, so you can read it up and be more informed. And one more important drug-drug interaction with Omeprazole is clopidogrel. Now, clopidogrel is also a blood thinner, and it is actually metabolized by this. It is metabolically activated by 2C19, and when that enzyme is inhibited, you can't activate clopidogrels. So this is also an important drug-drug interaction to be aware of with omeprazole. These can, so definitely all of this is, would be like common for the other proton pump inhibitors like rabeprazole, pantoprazole, lansoprazole. But these are specific. All of the other toxicities that I just mentioned are specific for omeprazole. And I just wanted to make a quick video on this. I hope that this was helpful. Thank you so much for listening. See you again next time when I make my next video. Thank you so much. Have a great day.